Company out there called Join Found. They're a national weight loss company, and the founder is an endocrinologist named Dr. Rekha Kumar. And I just happened upon this because somebody sent it to me. And this is an endocrinologist talking about basically perimenopause and how to manage it. And you're going to be a little bit shocked.
You put me on the pill for the low estrogen, and I have to say that I definitely feel different.
That's so great to hear, because I have to remind people that premenopausal hormone replacement therapy is a birth control pill. And that is stabilizing your hormones and replacing the hormones you're not making.
I can't scream loud enough when I hear doctors say that. First of all, premenopausal, what is that? Just call it perimenopause. The treatment for perimenopause is a birth control pill. This is what women have to deal with. This is a nationally known physician who has a company that helps women. She calls herself a menopause expert, and she's saying to treat perimenopause with a birth control pill. I'm literally dumbfounded.
So it can actually be quite life-changing in those early stages of hormonal decline.
Yeah, I found I'm sleeping better. And the thing that I've noticed the most is the irritability is pretty much gone.
Isn't that amazing? So,
yes.
First of all, birth control pills are progestins. They're not progesterone, so they're not going to help with sleep, and they're not going to help with irritability and anxiety. They won't increase allopregnanolone, and they're not going to increase GABA receptors in your brain. So if she's experiencing this, and I say if because she's interviewing this person, it's placebo.
Honestly, I could never imagine you irritable. You're like so sweet and bubbly all the time.
She's not irritable to begin with, so chances are I probably didn't do anything.
So clearly that was your hormones. That was not you.
I felt so just charged all the time with being irritated. And I'd go for a walk and just think like, is this who I am now? Just taking that little pill has really made a difference.
And it's not the size that matters. Just because it's a little pill doesn't mean that a woman who's 45 years old needs to take birth control pills to manage a hormonal imbalance. This makes absolutely no sense. I'm actually embarrassed that this is an endocrinologist, and I just can't tell you enough. Birth control pills are not a treatment for perimenopause or menopause.